Acetylcholine is the chief neurotransmitter of the parasympathetic nervous system, the part of the autonomic nervous system, which is a branch of the peripheral nervous system that contracts smooth muscle, dilates blood vessels, increases bodily secretions, and slows heart rate. The acetylcholine receptor is an essential link between the brain and the muscles, so it is a sensitive location for attack. Many organisms make poisons that block the acetylcholine receptor, causing paralysis. Symptoms of an acetylcholine deficiency include constipation, memory problems, difficulty with word recall when speaking, learning difficulties, dry mouth, dry eyes, orthostatic hypotension, low muscle tone, depressed mood, fast heart rate, chronic inflammation, and emotional instability. Excessive accumulation of acetylcholine at the neuromuscular junctions and the synapses cause symptoms of both muscarinic and nicotinic toxicity. These include cramps, increased salivation, lacrimation, muscle weakness, paralysis, muscular fasciculation, diarrhea, and blurry vision. Imbalances in the acetylcholine system are linked with chronic conditions like Alzheimer's disease and Parkinson's disease. Over 50 years ago, clinical studies suggested that increases in central acetylcholine could lead to depressed mood. Evidence has continued to accumulate, suggesting the cholinergic system has an important role in the mood regulation. Acetylcholine normally enhances cortical sensitivity to external stimuli, and it decreases cortical communication, increasing focused attention. However, increased acetylcholine signaling can lead to symptoms related to anxiety and depression. For example, while stress-induced acetylcholine release can result in positive adaptive responses to environmental stimuli, however, chronic elevations in cholinergic signaling can produce negative maladaptive behaviors. This is indicating how, like other neurotransmitters and functions in the body, balance is the key. Prevailing hypotheses of the pathophysiology underlying schizophrenia have largely focused on monoamines like dopamine and serotonin. However, there's increasing evidence from clinical and preclinical studies that aberrant acetylcholine signaling may also contribute to the disease. Epidemiological studies have long shown that schizophrenics exhibit higher rates of tobacco smoking than the general population, suggesting that patients may use nicotine, an agonist of an acetylcholine pathway, for self-medication. You can check out my other video on schizophrenia for more information about balancing neurotransmitter production to help this condition. Acetylcholine plays an important role in cognitive function, as is shown by pharmacological manipulations that impact working memory, attention, episodic memory, and spatial memory function. Acetylcholine also shows striking modulatory influences on the cellular physiology of hippocampal and cortical neurons. You can check out my video on nootropics and on choline sources for ways to help improve your focus, memory, and other cognitive functions through supplementation that affects acetylcholine. My video on brain-boosting herbs also has some natural ways to help to enhance acetylcholine levels in the brain. Evidence exists for both cholinergic and glutaminergic involvement in the etiology of Alzheimer's disease. Acetylcholine, the neurotransmitter essential for processing memory and learning, is decreased in both concentration and function in patients with Alzheimer's disease. My video on Alzheimer's disease has more information related to this and on ways to treat this. Acetylcholine, known to influence behaviours related to novelty seeking and exploration, through its action on various cortical and subcortical brain areas, is likely to have a role in mediating the change in emotional behaviour induced by a high-fat consumption. Clinical reports suggest a positive association between fat consumption and the incidence of hyperactivity, impulsivity, and cognitive abnormalities. Binging on fat is also found to predispose animals to increased cocaine seeking and risk-taking behaviour, suggesting that this diet may generally enhance risk-taking behaviours, whereas the ability of dietary fat to produce behaviours related to emotion, impulse control and cognition is now becoming more generally recognised. Choline is an essential nutrient and a building block for acetylcholine. Foods that are naturally high in choline include whole eggs, meat and fish, and whole grain. Studies in lab animals and in humans suggest that consuming food or supplementing food rich in choline may elevate levels of acetylcholine in the brain. However, for people who are consuming nootropics to enhance the choline in their brain, it's suggested that 4 eggs per day need to be consumed to provide enough choline support. This can be very difficult for most people, and they prefer to supplement with CDP choline or alpha GPC choline. Centrophenoxine. This supplement increases acetylcholine levels in the brain, and many report an increase in verbal fluency with doses of 1 to 2 grams per day. It's an enhanced version of the supplement DMAE, dimethylaminoethanol. This may help to reduce aging spots on the skin and also aging in the brain. However, it appears it increases acetylcholine in the brain by robbing it from the muscles. This could explain why there was toxic symptoms to babies when DMAE was taken during pregnancy. Therefore, if one is considering to use this for social anxiety, it would be advisable to limit its use and to supplement with other choline sources when you're not taking it, so your muscles don't become deficient in choline. The neurotransmitter acetylcholine is involved in tuning growth hormone secretion, and its growth hormone stimulatory action has mainly been shown in adults, but it's not clearly documented during development. Increasing growth hormone may have anti-aging benefits and may speed up the repair of injuries. You can see my other video on life extension with growth hormone, DHEA and berberine. Exactly how vitamin D works to preserve cognitive function is unclear. It may increase acetylcholine, which is the neurotransmitter for memory and brain function, which is found to be low in patients with dementia. So you can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any nutritional deficiency. B1 thiamine is required for acetylcholine production. Sulbuthiamine is the synthetic form of B1 that crosses the blood-brain barrier. People take sulbuthiamine by mouth for Alzheimer's disease, weakness, athletic performance, depression, diabetic nerve damage, erectile dysfunction, fatigue, and memory enhancement. Bacopa monnieri is one nootropic herb. It has the lowest chance of creating side effects over other forms of cholinesterase inhibitors. Emerging research demonstrates several mechanisms of actions: acetylcholinesterase inhibition, choline acetyltransferase activation, beta-amyloid brain plaque reduction, increased cerebral blood flow, and monoamine potentiation. Guatacola is another nootropic herb with research supporting its efficacy and few reported side effects. Several mechanisms of action of guatacola were demonstrated for enhancing cognitive functions, such as the inhibition of acetylcholinesterase activity, the reduction of phospholipase activity, protection against the beta amyloid formation, and protection from brain damage. Huperzine A is extracted from a type of moss. It's a potent cholinesterase enzyme inhibitor, while it's also been shown to be effective to improve memory due to mechanisms other than just the cholinesterase inhibition. Again, like serotonin and dopamine, a leaky gut or absorption problem can lead to nutrient deficiencies, which require higher than normal doses of supplements to correct. Digestion and nutrient assimilation can be enhanced by fixing a leaky gut, for example, by taking enzymatically preserved colostrum and taking the amino acid L-glutamine. Also, the elimination of common allergens from the diet, which may be causing inflammation, oxidation, and autoimmune conditions like gluten or high sugar consumption. Another type of absorption condition could be the MTHFR gene variation, requiring higher levels of B vitamins to be consumed in order to prevent the damaging effects of homocysteine from occurring. Many different nootropics work on acetylcholine, either by increasing levels of this neurotransmitter or by increasing receptor sites for more acetylcholine to bind to. There's a whole topic about the many different effects that can be had from the various acetylcholine-based nootropics. For example, oxiracetam is considered to promote work, whereas aniracetam is considered to be the best to improve creativity and social skills. Piracetam is considered to repair brain damage and have a subtle general brain-boosting effect. Other racetams are said to improve interest in what would normally be considered to be a boring subject, such as study. Other racetams again are said to improve the ability to hold and juggle numerous pieces of information in your brain, in your working memory. One could spend years slowly determining the best dose of each racetam for a desired effect, and have a whole cupboard of different racetams for different days, depending on the activity that's expected that day. While this may seem like a form of over-medication and an unnecessary crutch, and even an addiction, many biohackers who've been taking racetams for many years say how it has massively improved the quality of their life and their performance without producing any negative side effects. They also claim that it's permanently increased their IQ even after they stop taking these racetams. Probiotics. Mood, immune, and cognitive benefits of probiotics have been demonstrated, and a balanced microbiome appears to be essential to health. A new field of interest here could be psychobiotics, which are an emerging class of probiotics of relevance to psychiatry. Such mind-altering probiotics may act via their ability to produce various biologically active compounds, such as peptides and mediators normally associated with mammalian neurotransmission. Several molecules with neuroactive functions, such as GABA, serotonin, catecholamines, and acetylcholine, have been reported to be microbially derived, many of which have been isolated from bacteria within the human gut. Secreted neurotransmitters from bacteria in the intestinal lumen may induce epithelial cells to release molecules that in turn modulate neural signaling with the enteric nervous system and consequently signal brain function and behavior to the host. Consequently, neurochemical containing and producing probiotic bacteria may be viewed as a delivery vehicle for neuroactive compounds, and as such, probiotic bacteria may possibly have the potential as a therapeutic strategy in the prevention and the treatment of certain neurological and neuropsychological conditions.